If you've been following the peptide weight loss revolution, you've probably heard about semaglutide and tirzepatide. But there's a new peptide drug that's producing results that are making researchers call it the most powerful weight loss medication ever tested. It's called Retatrutide, and according to recently published clinical trials, people are losing an average of 24% of their body weight in just 48 weeks. That's more than any other medication we've ever seen. I'm going to walk you through exactly what Retatrutide is, how it works differently from other peptides, what the clinical trial results actually show, and the serious risks and side effects you need to understand before you get excited about this drug. Because while the weight loss results are genuinely impressive, this medication is still experimental. It's not yet approved by the FDA, and we're learning about significant complications that you need to know about. Let's start with the basics. Retatrutide is a triple receptor agonist peptide developed by Eli Lilly, the same pharmaceutical company that makes tirzepatide, which is marketed as Mounjaro and Zepbound. To understand why Retatrutide is so powerful, you need to understand how it's different from the peptides that came before it. Semaglutide, which is marketed as Ozempic and Wegovy, works on one receptor, the GLP-1 receptor. Tirzepatide works on two receptors, both GLP-1 and GIP receptors. That's why it produces more weight loss than semaglutide. But Retatrutide works on three receptors simultaneously. According to research published in the New England Journal of Medicine, Retatrutide activates GLP-1 receptors, GIP receptors, and glucagon receptors. This triple mechanism creates weight loss effects that we've never seen before in pharmaceutical medicine. The GLP-1 receptor activation slows stomach emptying and reduces appetite. The GIP receptor activation improves insulin sensitivity and affects fat metabolism. The glucagon receptor activation increases energy expenditure and promotes fat burning. When all three mechanisms work together, you get synergistic effects that are more powerful than the sum of their individual parts. That's why the weight loss results are so dramatic compared to previous medications. Now let's talk about the clinical trial results, because this is where Retatrutide really stands out from everything else we've seen. The main trial was a Phase 2 study published in the New England Journal of Medicine in June 2023. This was a 48-week randomized, double-blind, placebo-controlled trial involving 338 adults with obesity. Participants were randomly assigned to receive either placebo or one of 4 different doses of Retatrutide administered once weekly by subcutaneous injection: 1 milligram, 4 milligrams, 8 milligrams, or 12 milligrams. The results were remarkable. At the highest dose of 12 milligrams, participants lost an average of 24.2% of their body weight over 48 weeks. That's the highest weight loss ever recorded in a clinical trial for an obesity medication. To put that in perspective, if someone weighed 250 pounds at the start, they lost an average of about 60 pounds. If they weighed 300 pounds, they lost about 72 pounds. These are life-changing amounts of weight. But here's what's even more impressive. At the 8 milligram dose, the average weight loss was still 22.8%. Even at the 4 milligram dose, people lost an average of 17.3% of their body weight. Compare this to semaglutide, where the average weight loss is about 15 to 17% of body weight. Tirzepatide produces about 20 to 22% weight loss. Retatrutide is producing results that exceed both of them. According to the study published in the journal Obesity, approximately 91% of participants taking the 12 milligram dose achieved at least 10% weight loss, and 75% achieved at least 20% weight loss. These aren't just numbers on a scale. According to metabolic measurements in the clinical trial, participants also saw significant improvements in blood sugar control, blood pressure, cholesterol levels, and markers of fatty liver disease. The improvements in metabolic health were proportional to the amount of weight lost. People who lost more weight saw greater improvements in all their metabolic parameters. Now, before we go further, I need to ask for your support. If you're finding this information valuable, please click the like button. It helps other people discover evidence-based content about these new weight loss medications. And subscribe to this channel if you want honest, research-based health information without the hype or the sales pitch. Alright, now let's discuss how Retatrutide actually works in your body to produce these dramatic weight loss effects. The GLP-1 receptor activation is something we're already familiar with from semaglutide and tirzepatide. GLP-1 is a hormone your gut releases after eating. It signals your brain to reduce hunger, and it slows down how quickly food leaves your stomach. When Retatrutide activates GLP-1 receptors, you feel fuller for longer periods, you feel satisfied with smaller portions, and you experience reduced cravings between meals. This makes it much easier to maintain a calorie deficit. The GIP receptor activation adds another layer. GIP stands for glucose-dependent insulinotropic polypeptide. According to research in diabetes care, GIP improves how your body responds to insulin and affects how your body stores and uses fat. But it's the glucagon receptor activation that makes Retatrutide unique. Glucagon is typically thought of as the opposite of insulin. While insulin promotes energy storage, glucagon promotes energy release and fat burning. According to studies in cell metabolism, activating glucagon receptors increases your metabolic rate, meaning your body burns more calories at rest. It also promotes the breakdown of stored fat and improves liver metabolism. The combination of reduced appetite, improved insulin sensitivity, and increased energy expenditure creates a powerful metabolic shift. You're eating less, your body is processing nutrients more efficiently, and you're burning more fat. This explains why the weight loss with Retatrutide is greater than with medications that only target one or two of these pathways. You're addressing multiple mechanisms of obesity simultaneously. Now let's talk about side effects, because this is absolutely critical. While the weight loss results are impressive, Retatrutide comes with significant side effects that you need to understand. According to the clinical trial data published in the New England Journal of Medicine, the most common side effects were gastrointestinal. We're talking about nausea, diarrhea, vomiting, and constipation. At the 12 milligram dose, which produced the greatest weight loss, gastrointestinal side effects were reported by approximately 80 to 90% of participants at some point during the trial. These weren't just mild discomfort. Many people experienced significant GI distress. Nausea was reported by 61% of participants at the highest dose. Diarrhea occurred in 46%, vomiting in 38%, constipation in 27%. These are very high rates of side effects. The good news is that for most people, these side effects were worst during the first few weeks of treatment and during dose escalations. Many participants found that symptoms improved as their bodies adjusted to the medication. However, according to the study, discontinuation rates due to side effects were concerning. About 10 to 15% of participants in the higher dose groups stopped the medication entirely because they couldn't tolerate the side effects. There were also other side effects beyond gastrointestinal issues. According to the clinical trial data, some participants experienced dizziness, fatigue, increased heart rate, and hair loss. The hair loss is particularly notable. According to reports published in Obesity Reviews, temporary hair thinning or shedding occurred in a significant number of participants, likely related to the rapid weight loss rather than the medication directly. There were also concerns about potential effects on the gallbladder. Rapid weight loss from any cause increases the risk of gallstone formation. According to gastroenterology research, people losing weight rapidly on these medications have an elevated risk of gallbladder problems. Now let's address something that's not being talked about enough. What happens when you stop taking Retatrutide? According to follow-up data from obesity clinical trials, weight regain after stopping GLP-1-based medications is extremely common. Studies show that people typically regain about 2/3 of the weight they lost within 1 year of discontinuing treatment. We don't yet have long-term data specifically on Retatrutide discontinuation, but there's no reason to believe it would be different from semaglutide or tirzepatide. The medication suppresses appetite. When you stop, your appetite returns. This means Retatrutide should be viewed as a long-term treatment, not a temporary solution. If you're not prepared to potentially take this medication indefinitely, or at least for many years, you need to seriously reconsider whether it's appropriate for you. According to metabolic research published in Nature Medicine, the body has powerful biological mechanisms to defend against weight loss. When you lose weight, your metabolism slows down, your hunger increases, and your body tries to return to its previous set point. Retatrutide can override these mechanisms while you're taking it, but when you stop, those mechanisms come roaring back. Unless you've made sustainable lifestyle changes during treatment, weight regain is almost inevitable. Now, let's discuss who should and who should not consider Retatrutide if it becomes FDA approved. According to obesity medicine guidelines, candidates for this type of medication are typically people with a BMI over 30 or people with a BMI over 27 who also have obesity-related health conditions like diabetes, high blood pressure, or sleep apnea. But even within that category, there are many people who should not use Retatrutide. If you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, this medication is contraindicated. If you have a history of pancreatitis, you should not use Retatrutide. Clinical trials excluded people with a history of pancreatitis because of concerns about pancreatic inflammation with GLP-1 receptor agonists. If you're pregnant, planning to become pregnant, or breastfeeding, you should not use Retatrutide. There's insufficient safety data, and weight loss during pregnancy is not appropriate. If you have severe gastrointestinal disease, gastroparesis, or inflammatory bowel disease, Retatrutide could worsen your symptoms due to its effects on gut motility. If you have an eating disorder or a history of eating disorders, appetite-suppressing medications can be extremely dangerous and can trigger or worsen disordered eating patterns. Now, let's talk about the elephant in the room: availability and cost. Retatrutide is not yet FDA approved. It's currently in Phase 3 clinical trials. According to Eli Lilly's development timeline, FDA approval is not expected until at least 2026, possibly later. When it does become available, it will almost certainly be very expensive. Semaglutide costs about $1,000 to $1,300 per month without insurance. Tirzepatide costs about $1,000 to $1,500 per month. Retatrutide will likely be in the same range or potentially higher. Insurance coverage will depend on your specific plan and whether your doctor can document medical necessity. Many insurance companies are currently restricting coverage of these medications due to high costs. There's also the issue of supply. When semaglutide and tirzepatide were approved, there were significant shortages because demand far exceeded manufacturing capacity. The same thing will likely happen with Retatrutide. Now, I want to address something I'm seeing online that concerns me greatly. There are already people trying to obtain Retatrutide from research chemical suppliers or overseas pharmacies before it's FDA approved. This is extremely dangerous. According to pharmaceutical safety research, medications purchased from unregulated sources frequently contain incorrect doses, contamination, or completely different substances than what's advertised. If you're considering Retatrutide, you need to wait until it's FDA approved and prescribed by a licensed physician through a legitimate pharmacy. Your health and safety are not worth risking for early access. Let's discuss what you should be doing right now if you're interested in Retatrutide for the future. First, work on optimizing your health and preparing your body. Get your metabolic markers checked: blood sugar, hemoglobin A1C, lipid panel, liver enzymes, kidney function. Know your baseline. Second, start building sustainable eating habits now. According to behavioral medicine research, people who develop healthy eating patterns before starting weight loss medication have much better long-term success. Learn proper portion control, practice mindful eating, increase your protein intake. Build a repertoire of healthy meals you actually enjoy. These habits will serve you whether or not you ever take Retatrutide. Third, establish a consistent exercise routine. According to research in obesity medicine, people who combine medication with regular exercise lose more weight and maintain that weight loss better than those who rely on medication alone. You don't need intense workouts. According to exercise physiology research, even moderate activity like brisk walking for 30 minutes most days of the week provides significant metabolic benefits. Resistance training is particularly important. According to studies in metabolism, strength training helps preserve muscle mass during weight loss. This maintains your metabolic rate and prevents the extreme muscle loss that can occur with rapid weight loss. Fourth, address any underlying psychological factors related to eating. If you eat in response to stress, boredom, or emotions, medication alone won't solve that. Consider working with a therapist who specializes in eating behaviors. According to psychological research, people who address emotional eating patterns before or during medication treatment have better long-term outcomes and are less likely to regain weight. Fifth, have realistic expectations about what medication can and cannot do. Retatrutide is a powerful tool, but it's not magic. You still need to make lifestyle changes, you'll still need to manage side effects, and you'll likely need to stay on it long term. Now let's address some important questions about Retatrutide compared to other options. Is Retatrutide better than bariatric surgery? According to comparative research, the average weight loss with Retatrutide in clinical trials is similar to what's achieved with sleeve gastrectomy surgery. However, bariatric surgery produces permanent anatomical changes, while medication requires ongoing treatment. Surgery has its own risks and complications, but it doesn't require daily or weekly adherence to medication. According to long-term follow-up studies, people who have bariatric surgery and then regain weight have fewer options left. People who try medication first still have surgery as a backup option if needed. Is Retatrutide better than semaglutide or tirzepatide? Based purely on weight loss results, yes, Retatrutide produces more weight loss on average, but we have much more long-term safety data on semaglutide and tirzepatide. Retatrutide is so new that we don't yet know about long-term effects beyond 48 weeks. We don't know about effects on bone density, muscle mass, or other metabolic parameters over years of use. According to pharmaceutical development research, it typically takes 5 to 10 years after FDA approval to fully understand the long-term safety profile of a new medication. Can you switch from semaglutide or tirzepatide to Retatrutide? Once Retatrutide is approved, this will be a decision you make with your doctor. There will likely be protocols for transitioning between medications. However, according to endocrinology practice guidelines, switching between different peptide medications requires careful monitoring and dose adjustment to manage side effects and maintain efficacy. Now let's discuss some emerging concerns about these ultra-powerful weight loss medications that you need to be aware of. According to research published in JAMA Internal Medicine, there are growing concerns about loss of muscle mass alongside fat loss with GLP-1 based medications. Preserving muscle is crucial for metabolic health and functional ability, especially as we age. Studies using DEXA scans show that about 25 to 40% of the weight lost on these medications is lean tissue, not just fat. This is concerning because muscle loss decreases metabolic rate and can lead to weakness and frailty. This is why resistance training and adequate protein intake are absolutely essential if you're using these medications. According to sports nutrition research, consuming 1.6 to 2.2 grams of protein per kilogram of body weight can help preserve muscle during weight loss. There are also concerns emerging about potential effects on bone density. Rapid weight loss from any cause can affect bone health. According to bone metabolism research, weight-bearing exercise and adequate calcium and vitamin D intake become even more important during rapid weight loss. Another emerging concern is the psychological impact of these medications. According to psychiatric research, some people experience mood changes, depression, or anxiety while taking GLP-1 medications. The mechanism isn't fully understood yet. There have also been reports of suicidal ideation in some patients taking these medications. The FDA is currently investigating whether there's a causal relationship. This doesn't mean the medication causes these thoughts, but it's something being studied carefully. If you experience any mood changes, depression, or concerning thoughts while taking any weight loss medication, you need to contact your healthcare provider immediately. Here's my bottom line recommendation on Retatrutide. The weight loss results from the clinical trials are genuinely impressive, the most powerful we've seen from any medication. But this is still an experimental drug that's not yet FDA approved. The side effects are significant, with most people experiencing gastrointestinal symptoms. The long-term safety profile beyond 1 year is still unknown, and we don't yet know how people will maintain their weight loss after stopping the medication. If Retatrutide does get FDA approval in 2026 or beyond, it will likely become an important option for people with obesity who haven't succeeded with other approaches. But it should be used as part of a comprehensive treatment plan that includes diet, exercise, and behavioral support. This is not a standalone solution. It's a tool, a powerful one, but still just a tool. Your long-term success will depend on the lifestyle changes you make while you're taking it. If you're currently struggling with obesity, don't wait for Retatrutide to become available. Start working on the fundamentals now. Improve your eating habits, increase your physical activity, address emotional eating, get your metabolic health checked. If you're already taking semaglutide or tirzepatide and having good results, there's no reason to switch to Retatrutide when it becomes available unless your doctor recommends it. The medication that works for you is the right medication. And if you're considering any of these peptide medications for the first time, have a thorough conversation with a physician who specializes in obesity medicine. Make sure you understand the commitment involved, the potential side effects, and the long-term implications. So here's my question for you. Are you currently taking any peptide medications for weight loss? What has your experience been with side effects and results? Or are you waiting to see what happens with Retatrutide? Share your thoughts and experiences in the comments section below. This is an evolving area of medicine, and hearing real experiences from real people helps all of us make better informed decisions. Please click the like button if this information was helpful to you, and subscribe to this channel for more honest, evidence-based coverage of new developments in weight loss and metabolic health. I'll continue following the Retatrutide trials and will update you as more information becomes available. Thank you for watching, and I'll see you in the next video.